When I come to Armenia, they ask me how many operations I do, and that's really not the intent here.
Our principal effort here is to educate. Ultimate goal is to allow the Armenians to take care of themselves.
We've brought 10 people over for fellowships to America, all expenses paid.
When I first came in America, everything was completely different.
I felt that I really had very little knowledge of what's going on in the world. I watched him doing these surgeries, and now I am practicing those I'm doing in Armenia.
Those who have come to the U.S. become the heads of departments here, and they can teach their trainees to duplicate themselves.
And even if the project stopped tomorrow, that would be a permanent benefit for the country.
That's what we call sustainability. It continues on.
When I came back here, I wanted to share all my skills with my colleagues.
I got in big energy.
I had so much energy to share all this, impatient to give all these lectures.
And I started to teach them everything I knew. The first thing we did was a huge conference.
And we began just in 1 month after my coming back to do the services, lasering.
Ամենակարևոր ձեռքբերումը, որ մենք ունեցանք այս ծրագրի շնորհիվ, դա վստահությունն է.
When I was there in 1986, whenever they had a difficult eye problem, they would send that patient to Moscow.
Կոմունիստական ժամանակ մենք բացարձակ այդ հնարավորությունը չունեինք.
Would you believe now that they're coming from Moscow to Yerevan to get their eye care?
We're doing surgery for patients from Syria, from Iran.
And what's nice is when these patients come from other countries to Armenia, they pay full price, so that it's become now a way that they can be self-sustaining.
Within the poverty, other things may not be available. Something as simple as a pair of eyeglasses.
Ուրեմն 5 տարի է ես նրան առաջի դասարանից դաս եմ տալիս, ես նկատել եմ, որ նա լավ չի տեսնում։
Որ գրատախտակին ուսուցիչը սկրում է, ես չեմ տեսնում, այդ գրածը մոտիկից եմ էթում նայում եւ արտագրում տեքստից մեջ։
Դժվարանում է կարդալուց, դրա համար չի սովորում, այդ առարկաները թույլ է։ Դե ինչ անենք։ Դա միշտ էլ բողոքել է, բայց դե որ հնարավորություն չկա հետևելու, տենց էլ մնացել է։
Փող չկա այդքան։ Չունենք։
For the people who are truly too poor to buy their own glasses, we are now adopting a system of eyeglass distribution.
It's the easiest way to correct blindness in some people. They're literally blind because they're not wearing glasses.
The Armenian Eye Care Project has provided tens of thousands of glasses.
Եթե աչքերի համար չգային, ոչ միտեղ էլ չէին գնալու, որովհետև գյուղում ոչ բուժկետ կա, ոչ բժիշկ կա։
Որակնոցներ կա, լավ է արդեն սան հետո լավ կսովորեմ։
One of the partnerships that we have is with the U.S. government.
Well, at USAID, when we're running an assistance program, we look for partners that bring a couple things to the program. Number one, are they having effective results? The Eye Care Project certainly is. We also look for accountability, because we're stewards of the taxpayer money. They have that as well. We look for sustainability. They're not only going to come here and do something good, but they're going to leave something behind. And the Eye Care Project certainly has that.
Cataract is a woman who is a fantastic singer.
It's the type of voice where she sings and everything's silent. All of a sudden, everyone hears and stops what they're doing.
She has a pitch-perfect voice that has been lauded in various other places in Armenia and the world, though she is nearly completely blind.
Ես իրա համար կարդում եմ, աչքերն եմ իրա, փողոցը ես իրա հետ դուրս են գալիս փողոց։
Եկան ամերիկացի բժիշկները եւ ուղղակի փրկեցին.
Rick Hill operated on her to save the sight in one eye, and that eye has now developed a cataract. Let's have the retina people take a look at her and make a decision. So we're just waiting for him now to find out what his decision is on it.
but I think that eye has reasonable vision potential based on the history that I'm hearing.
I have no fragmatome.
Oh, you don't have a fragmatome? Oh.
All right. That's just with the projector, maybe. If
We don't
it's
have,
soft lens,
I thought you had a fragmatome.
No, it's not working.
We can't do this case without a fragmatome.
So at this point in time, because the instruments aren't available to us, that we're going to leave it alone.
Ես հավատում եմ, որ լավ կլինի։ Ես ուզում եմ, որ իմ տեսողությունը կլավանա։
I still think that there's a lot of challenges to be faced here, quite honestly.
People ask what's in it for me.
Why do we continue to go back to a country where there's a lot of work, a lot of effort, a lot of bureaucracy?
To see a child that's going blind and say, you know, that's not going to happen here. That's not going to happen on my watch.
I remember one child was brought in. He had penetrating injuries into both eyes. Both eyes became infected. Both eyes had to be removed. They brought this kid all the way over from Cataract. This had happened 6 months before. And I looked at him and I said, well, what can I do? I mean, he's already had both eyes removed, but he's crying. Well, why is he crying? Is he still in pain? And his parents were crying too. And the interpreter talked to them and he turned back to me and he said, no, they thought you brought new eyes from America. And that level of trust in what America can do and what the diaspora can do is what keeps us all going.
Մենք 15 տարի քայլում ենք իրար կողք եւ այդպիսի ծրագիր չկա այստեղ.
Big thank you.
Շատ շնորհակալություն եմ հայտնում ես ձեզնից։
Սա բոլորը ցավնական են ես։
Ես ամբողջ կազմակերպությունից որսի հնարավորություն ստեղծեցի։
Սամար ես երբեք չեմ մոռանալ։
Շատ շնորհակալ եմ։ Հետ կաթողած մեր սրտում որ դա մոռանալի բան է։